Okay, I'm going to be talking about rheumatic fever and rheumatic carditis. This is going to be a real short little deal for you. You're all probably familiar with rheumatic fever. This systemic inflammatory disease, and often it follows the group A strep. That's the throat infection that we all go and talk about. Somebody's got strep. Can be very serious. We need to be on the lookout for the signs and the symptoms, and we need to educate not only ourselves but all our clients about seeking treatment and following the treatment through to the end of the prescription. That's very important. What happens is that about half of the people that will develop rheumatic fever will then go on to develop rheumatic carditis. And that, of course, is an inflammatory process that affects the heart, and not just, just about all layers of the heart, but in particular the endometrium. But it can affect the myocardium and the pericardium as well. But it causes especially the endocardium and the valves. Those little leaflets that are smooth and close delightfully, well, they'll get plaque on them and vegetation growth on them, and they won't close properly. Then we'll have leaking and not closing and all sorts of problems in particular later on, but we can also have some pretty quick if they're not treated. But that's the sneaky part, is that sometimes we will have the effects of the untreated rheumatic fever will show up much later in life with damage having already been done to the layers of the heart and in particular the valves and all. But in particular, remember that half of people that have rheumatic fever will develop rheumatic carditis. And so what happens is that the antibodies that are present, which we want them to be there to help fight off infection and what have you, but they mistakenly jump in and react against the proteins in the connective tissue of the heart, and it causes damage to all. It can cause damage to all parts of the heart. So it's a big deal that we educate people to seek treatment and to take the full prescription of antibiotics. Just a cute little picture here showing a patient with a sore throat, come to the doctor, little decision tree, get a swab, do the strep test, get treatment, the antibiotics usually for 10 days. That's generally some type of penicillin. If the patient is allergic to penicillin, they'll be put on some kind of an erythromycin drug. So guess what? We've prevented the rheumatic fever, and the heart stays healthy. Yeehaw! Now, here we go. Not seen by a doctor, just treated with home remedies, gargle, and what have you. No treatment. Rheumatic fever may develop, and we can have some permanent damage to the heart. Ooh, frowny face. So, here are signs and symptoms of the rheumatic fever. Usually it's a pretty abrupt onset, and they'll have a moderate to a high fever, and we all know, kids can run those high fevers and then be healthy as a little horse the next little bit. But we really need to check these out, because we don't want these sick hearts later. So it's abrupt onset of the sore throat. Usually the throat is reddened and they'll have some drainage, exudate back there. Not all of those that have exudate are strep, but they certainly need to be checked out. Quick little, swab and they're done. And they will also have enlarged and tender lymph nodes. And like I said, half of these patients will go on to develop rheumatic carditis. And with the rheumatic carditis, as you can imagine, we have a heart rate that's increased. Cardiomegaly, the heart can become enlarged. Murmur is going to be one of the big giveaways. Possibly a pericardial friction rub, changes in the EKG, and can lead to heart failure. Not anything that we want to have happen to us or our loved ones or our clients. So for the rheumatic carditis, how are we going to diagnose that? They'll do a titer on it, which is particularly a strep test, blood test, SID rates, and some other inflammation markers. Check them out. EKG, echocardiogram. The echocardiogram will be a real good diagnostic tool to see how much and where the damages and problems are in the heart. Again, the treatment's going to be penicillin, aspirin to prevent clots, because if these leaflets aren't working right and the muscles enlarge, the heart's enlarged, clots are going to maybe be sitting in there. They'll also give steroids to suppress inflammation, and then later on down the line, they may have to have surgery for repair of their heart valves. And we certainly want to prevent all of that. So the big thing for us to do is to really educate. Now, while the person is recuperating from their rheumatic fever and rheumatic carditis, is certainly to promote rest. They don't need to be up jumping and having a big time. They need to be quiet, taking their antibiotics, keeping hydrated and what have you, but rest and relaxation is a big deal. Looking for the treatments, and also looking to see that the treatments are being effective. So, and we all know when antibiotics are not working, if their fever's not subsiding and what have you, they're not progressing. But making sure that they get the prophylactic antibiotics that they need, that is a big deal, and that they take it to the fullest, all the prescription. And then also that these patients, once they have developed the rheumatic carditis, they're going to have antibiotics before any invasive surgeries or dental work, anything like that. So you can see on chart in IGGI 37-7, which is on page 763. You might want to look over that. Great. Thank you.